Talofa Andrea and Andrew and Born and Bruna. Hello to Chuka and Claire and David and Ellie and Greta. Wanya to Leema and Megana and Omar and Ripal Ben and S and Sejal. Bonsoir to Somaya and Tom and Eru. Hi to David. And hi to those of you joining us via recording. Welcome to the OUM webinar for this May. I'm Associate Professor Nicolette McGuire-Carter, and I'm the host for these sessions. Tonight's session, we were to meet one of our OUM graduates, but they've been called away for a family issue. We want to make sure that every member of our community is supported in health and wellness. So we'll definitely excuse that absence tonight, and we will make sure that we have an upcoming webinar with another one of our graduates. However, I thought for today I would give you some information about some of our soon-to-be graduates and what it's like to become a medical student to help support your journey in your decision-making for choosing a medical school, whether you choose OUM or choose another school that meets your needs. We want to make sure that everyone that becomes part of the OUM community is here and a valued member of our community, and we want to make sure that it's the right fit for you. So I hope to give you some further information to support your decision making today. Please feel free throughout the session to ask questions of any kind, sort, and manner using the Q&A box. If you haven't been to these sessions before, these are sessions that I run monthly. And when you register, you're also able to submit questions in advance of the session. So I'll take some of those as well. And you can also you can also ask questions in the Q&A box. So typically we answer questions that are specific to our interviewee. But for me, I am the OUM Associate Dean for Student Engagement, and I've been with the university since 2012, so I can answer almost every question that you may throw at me. I'll do my absolute best. If I'm not able to answer your questions today or get to them all, I'll make sure to pass them along to our admissions counselors, because we want to make sure you have all the information that you're looking for in joining us for our session today. So I'm going to share just a couple of slides. I promise I'm not going to be reading off bullet points as part of this session, but I do like to have a few things that get your minds thinking about some of the things that we can chat about today. We have students from 5 different jurisdictions here at OUM. So you must be a citizen or permanent resident of either Australia, Aotearoa, New Zealand, Samoa or American Samoa, the United States or Canada, in order to be a student at OUM. One of the things that I love best about being at OUM is being in a classroom with students from all across the world. We actually have students that all of our students are citizens or permanent residents of those countries, but they come from 53 different birth countries. So there's lots of different languages spoken, lots of different backgrounds, many different ages, many different career and school trajectories that we have at our university. So the pictures that you're seeing in front of you right now are students who are at a class called CTU, which is our Clinical Transition Unit. And for those of you who are in Australia and Aotearoa, New Zealand, this is the Clinical Transition Unit that you would be attending after you complete your preclinical systems courses. This is being held for our students in Brisbane. You can see they're wearing their OUM scrubs, and they're learning some clinical procedures and maneuvers here. So this is a week-long clinical skills class that we run in Brisbane for our students located in Australia and Aotearoa, New Zealand. And it's a great time for our students to get together, not only for the clinical aspects, but also to get a chance to get together with students that they've been having classes on Zoom with, or maybe we have, students who are from Tassie or who are joining from Perth, or students who've been in study groups together in person in Brisbane, and they have a chance to come and work together during the CTU. And then this is a picture of some of our students who have completed their final clinical exam, which is called the OSCE, or the Objective Structured Clinical Examination. So this is the last examination that you take as a medical student. So after your clinical rotations, you come in and do an exam that has 15 stations where you have a mock patient, and you have to go through and do a patient history and order labs and make a diagnosis and come up with a treatment plan for those cases, and you get graded on that. So we can see here that these students look like they have a little bit of trepidation before they're entering their examination here at the facility in Brisbane, and after they've finished and completed their exam successfully, they are just almost on their way to getting their graduation requirements review and graduating with their MD. And we can see some of the lovely staff members at our Brisbane facility that help facilitate the OSCE, the Objective Structured Clinical Examination, to support our students to becoming doctors, to realizing their lifelong dreams. So one of the reasons why I wanted to show you this picture is that at one point, all of these 6 students sat exactly where you're sitting right now. Maybe they're not sitting in your exact chair in your exact apartment or in your friend's house or wherever, but they all sat in the same space wondering, should I continue to push down these thoughts and feelings about becoming a medical student? Should I continue to push down these dreams I have of becoming a doctor and just continue on with my life as I know it? Or should I just push the button? Should I take the leap and start to realize the calling that I've had for a long time? So each of these 6 have done it, and there's nothing any different about any of these students from any of you, other than that they made that choice earlier than you did. All of these individuals have different histories and backgrounds and different motivations for becoming physicians, but all of them are the proof that it doesn't matter when you start. It doesn't matter when you think is going to be the right time, or if you think you're going to sail through, or if you can't do it, you can do it. These students can do it. You can do it too, if you have the motivation and the resilience to be able to do so. And OUM, we care and know each and every student that comes through our doors. So it's a huge milestone, not only for these students, but for all of us as faculty and staff and student cohorts as well, when each of our students are passing their OSCEs, their final clinical exam. Okay, so these are some of the things that I want to talk with you about today that I encourage you to ask questions about in the Q&A, and I'll take these as we go. And I'll take this off and on, kind of flash it on and on, just because I don't like to have slide decks up the whole time, because I like to have a conversation. So feel free to put things in the Q&A, or if you'd like to raise your hand and take the microphone, you're also welcome. Some people prefer to speak, and you're more than welcome to. If you'd like to take the microphone, just raise your hand and I'll enable that. So what I'd like to talk with you about today is about thinking about your motivation to become a clinician. Thinking about your career prospects before you make the decision to become a medical student, thinking about finances, thinking about maintenance of your health, mental health, and well-being, what it's like day to day as a preclinical student, and what it's like day to day as a clinical student, and then finally licensure and internships. And this is another class of students who have completed their CTUs, their clinical transition unit, as they're going into their clinical rotations. And you can see they have a little bit of trepidation, but also excitement in completing that and getting started on their clinical phase and what it will be like for them day to day. Okay, I'm going to take these slides down for a minute, and I see I already have some questions in the Q&A, so I'm going to start there. And I'm going to start with Anonymous, who has a really popular question that we get a lot, which is, what clinical placement locations are available in Australia, and can you arrange your own? Okay, so we have clinical placement locations. I'm going to see if I remember all the states in Australia. So you guys can all help me out if I forget them. Okay, so we have clinical placements in Queensland, Western Australia, New South Wales, Victoria, Tasmania, the ACT, and I'm forgetting one. What's the other one? I got them all? Okay, so what I want to say is we have clinical placements in all states at the moment in Australia. And you can arrange your own, but I want to put a caveat on the word arrange. So can you identify your own? Yes, you can. Can you arrange your own? No, you cannot. You need to work with the school because you cannot just say, I want to work with this doctor. This doctor wants to work with me. I'm going to show up on Monday. And we need to make sure that each and every clinical site that our students have their clinical rotations on is going to meet our safety standards and our educational standards, and also that we have all the relevant paperwork to keep you safe on site and to keep patients and staff on site while you're there. So as you can imagine, that's not a very glamorous side of arranging clinical rotations, but nevertheless, it has to be done because your health and safety are paramount to us as much as your learning and academic experience are. So we currently have clinical placement locations across Australia, and we do have students who are identifying clinicians that they would like to work with, who then work with our dedicated clinical rotations team to ensure that a rotation can take place in that area and with that clinician. So one of the things that you'll hear about OUM is that the preclinicals are done online, and you can do your classes in place, basically wherever you are, and that your clinical rotations are done on site. So although we have clinical placement for rotations across Australia, that doesn't mean that if you live in Sydney, you're going to complete all of your rotations in Sydney. Instead, what it means is that we expect that our students do travel to complete their clinical rotation. So we do have one site that we require all students to travel, whether you are in Australia, Aotearoa, New Zealand, Canada, the United States, or Western Samoa, and that site is Samoa. We have a teaching hospital in Apia, Samoa, called Tupua Tamasese Mea Ole Hospital, or TTM Hospital in Samoa. It is an absolutely amazing experience for hands-on clinical teaching and hands-on clinical patient care. So all students at OUM complete at least 4 weeks of rotations in an area of their choosing at TTM Hospital in Samoa. So all students have to travel for that rotation. And we do expect that our students who are in Australia will travel to different states to take on different rotations. There is the case that you may be able to get all of your rotations in one site, but that would mean that they would be further between. It would take you longer to complete your degree. So the way that our university is structured is that you're going to have your time in your current residence, your current space for your preclinicals, and then you'll be traveling for your clinical rotations. We really actually like this setup because one of the things, which I mentioned earlier, it's great about OUM is that you get to be in classrooms with people from all over the world. And then you also get to have clinical experiences in many different types of sites. So you'll have clinical experiences in urban downtown hospitals. You'll have clinical experience in emergency and urgent care in rural areas, in northern areas, et cetera. Oh, we don't have any rotations in the far north of Queensland, but in mid area of Queensland we do. So yes, there are clinical rotation placements across Australia, but we do expect that students travel during their clinical rotations. You can, if you do have connections and doctors that you'd like to rotate with, you can identify that to our clinical rotations team, and we do work with sites to arrange those types of rotations. You cannot fully arrange a rotation on your own. Okay, Born has a question. Born would like to know, is the uni tuition Commonwealth supported? No, it is not. Can the Australian government pay tuition for us and then we get to pay when we graduate? So we don't have any Commonwealth supported places at OUM. That is because OUM is not an Australian university. OUM is located in Samoa at TTM. TTM Hospital is our teaching hospital, so we're not considered an Australian university because we're not located in Australia. We do have clinical sites and a site in Australia, but we're technically a Samoan university, so we do not have Australian Commonwealth supported places. And Bourne says they live in Canberra. Is there a place for their placement or clinical studies in Canberra? Yes, there is. One thing that I will also say is that we're constantly updating our rotation sites. So sites come on and off of our clinical rotation roster, but we do consistently have clinical rotation sites in major cities within Australia, including Canberra. Okay, Bruna would like to know, for students in the US pathway, where are the OSCEs typically conducted? Are they held at US clinical sites or is travel required? Thank you. So currently the OSCEs are conducted in Kansas. So if you live in Kansas, then you don't have to travel very far, but travel is required for the OSCE if you live outside that area. Typically, students in the US also are traveling for their clinical rotations, as well as students in Canada. The only students that we don't have that travel advisory for, that travel push for, are our students who are our Samoan students, who typically do all of their rotations at TTM Hospital in Samoa. Okay, Anonymous wants to know, what is the full cost of the degree in Australian dollars? I'm struggling to understand the credit point system. What financing options do students take out? So I'm just gonna, I'm gonna pull up my slides for a second again, so I can say that tell you where I'm focusing. Okay, so we want to focus a little bit on finances, but I want to talk about career prospects too. Okay, so the full cost of the degree in Australian dollars. So on our website, we do provide the credit point cost in Australian dollars, in New Zealand dollars, in Western Samoa Tala, in US dollars, and in Canadian dollars. So that is the current cost of each credit point. So there are 102 preclinical credits, 102 preclinical credits, 8 research credits, and 72 clinical credits. So the cost of each credit point is 1 credit. So there are 182 credits, and the cost of each credit point is available on the website. So the caveat for that is that the credit points change each year. So we go by the consumer price index to set changes in our credit point cost or in our tuition cost. So every year in September, when the CPI, the consumer price index, is released, we will release the credit point cost for the upcoming year. So in September, you'll know the credit point cost for January. So for those of you who are planning to apply for January 2027, we will know the credit points cost for 2027 in September of next year. So we cannot predict the consumer price index. If we could, we might be in finance or in like hedge funds or something instead of in medical education. But typically that goes up around 2 to 3% each year. So you can estimate the cost of the degree based on that. So we try to be as transparent as possible with how we set our tuition and fees to help you calculate the cost of your degree, but we cannot fully predict what inflation will be over the next 4, 5, 6 years, depending on when you start your degree. So I cannot give you a full cost of the degree right now. But I can tell you that the number of credit points is the number of credit points, and the cost is what it is today and goes up by a certain percentage each year based on the consumer price index. So our CFO, our Chief Financial Officer and bursar, is really invested in making sure that students understand their tuition and any fees that are associated with the degree. And she and I did do a webinar last month or the month before. So if you want a little bit more information about how that's all calculated and how students pay, you can go to our YouTube channel and have a look at the financial services webinar. Or if you're in touch with an admissions counselor, they can send you that link directly. And for those of you who are not in touch yet with an admissions counselor, I highly recommend you just push the button on the website that says talk to us now. Shanda and Camille are so kind and they have so much information. Don't be afraid if whatever question you have or whatever stage you're at in your decision making, don't be afraid to just reach out. They're more than happy to give you their time to help with your decision making. So don't feel nervous to reach out to them if you haven't already. Okay, I want to just pause for a second. I'm going to continue on with the questions in the Q&A just to talk a little bit about motivation and career prospects. So I want you to just have a look at the students that are in this picture here. So the motivations that they have for becoming clinicians are as diverse as those particular people. So no two people have the same reason or rationale for wanting to become a doctor. The one thing that they do have in common is that the motivation is really strong. It's something that they've tried to get rid of for a long time because it would be a lot easier to just not become a doctor. Really, honestly, whatever you're doing now, whatever career you have in front of you now, it's going to be easier for you to do that career than to become a doctor. And to be a doctor, honestly, it's a very difficult job. It takes up a lot of mental space. Sometimes it's at the cost of your own health and mental health and well-being. We really try to prevent that, but it's difficult. Going through medical school is really hard. It's really taxing on your brain. So it's easier not to become a doctor. So if your motivation isn't strong, and if your motivation is just because doctors happen to make a good salary, it's not going to be enough to get through medical school. It's not going to be enough to get through the rigors of what it's actually like to be a doctor. So maybe you have motivation that someone in your family was ill and you feel like if only this had happened, they could have been prevented death or disability. Maybe you really loved learning something when you were young about a disease and thought that was really cool. And the way that doctors approach that was a really interesting way of thinking. Maybe you've been a nurse for a really long time and you're like, I know so much more than these doctors. Like, why am I not in charge? Like, I could figure this out if I just had that deeper depth of knowledge that I don't have now. I'm smart enough. Like, if this person can do it, like I definitely could do it better than this person. Like I should just be a doctor. Everyone that said that I couldn't do this or that it's too late for me, like this is my motivation. Like whatever it is, it just needs to be strong. So the thing that these people have in common is that their motivations are all different, but they're all very strong. And that goes into career prospect. So a lot of these individuals had really great careers before they went into medical school. So I mentioned, some people are nurses or paramedics, engineers, teachers, business people. So some people are coming right out of university, but have, many different choices for what types of careers that they want to go into. So it's really important when you think about if you're changing careers or if you're going into medicine as a career, like, what do you want to ultimately have out of your career? Once you're get your MD and you're in medicine, like patient care is part of that. And most clinicians will go on to becoming physicians that support one-on-one patient care in many different areas of medicine. But some become administrators, some become researchers, some become scientists, some work in pharmaceuticals, some work in hospital administration, some run clinics. So there's lots of different things that doctors can do. The thing that we train for at OUM is for clinicians to have compassionate, empathetic, knowledgeable patient care to serve the communities of Oceania and beyond. But there are career prospects above and beyond that too. So things that you can think about as you consider medicine. Okay. Born has a question about this. After studies, can I automatically start working in Australia or eligible to start working anywhere in Australia? Or do I have to do an assessment to be eligible like international doctors do? So our students at OUM do take the AMCs, the Australian Medical College test 1 and 2, because they are considered IMGs or international medical graduates, because Samoa is international to Australia, and OUM is located in Samoa. So our students do take their AMCs, and that's part of their plan after graduation. And many of them they will work that into how they apply in their internship year and so on and so forth. So we have a really great track record for students passing AMC on mostly on their first time. Sometimes students take it a little bit early and they're not quite ready. Students have a number of different prep options for AMC. We also have some resources being developed at the university to support AMC prep as well, in collaboration with our alumni association. Okay, Anonymous wants to know about clinical placement locations that are available in the US, and can you arrange your own? So we currently have our main clinical site in the US is in West Virginia, but students also can identify rotation sites and rotation clinical supervisors that they would like to work with. They'll be put through the same process that I talked about earlier in Australia, but we have a dedicated team in the US that do that as well. So you can identify your own, but you cannot arrange your own, similar to in Australia. Okay, Repal Ben wants to know, could you please explain more about license exam and internships for Australia? As an international graduate, is it easy to get into internships? So what I will say is that for no graduate of medical school, is it easy to get an internship? It's not easy to get an internship for any medical student, because getting into medical school is very hard. Getting through preclinicals is very difficult. Getting through clinicals is very difficult. Taking your OSCEs is very difficult. Preparing for your AMCs is difficult. Taking the AMC is not as difficult as the preparation required. And then, of course, you've got to go through your application and interviews for your internship. So I would never call getting an internship easy. However, what I would say is that I would answer the question, do OUM students get internships in Australia? Absolutely, they do. We have OUM students who are in internships and working as medical officers and even registrars across the states in Australia. So it's not easy to get an internship, but there's no kind of additional barrier, I would say, other than the AMC exams versus a student that's in Australia. So the one thing that students at international medical schools do need to do is to be aware of their networking. So when you are doing your clinical rotations and working with supervisors and working in clinical sites, one of the things, I mean, you are learning clinical skills there and patient care and all of that, but one of the things that you are doing is essentially doing a pre-interview for those clinical sites. So you're making connections there. You're seeing, oh, is this the kind of place that I might like to work? Would I like to continue to work in this area, in this clinical area? Would I like to continue to work with this clinical team? Do I want to, is this a place that I would see myself having an internship? So it's really networking, not only in Australia, but in all of the countries that we serve is a really important thing to do when you are thinking about your career prospects and where you would like to do your internship. So it's important for you to not only, have good clinical skills, but also to be someone who is prompt, who is ethical, who's practicing safely, who works well with the interprofessional team, who is kind and respectful and empathetic with patients, who exhibits professionalism. So these are all skills that we also teach as part of our coursework in the clinical and preclinical years as well. It's not just filling your head with information about thyroid hormone and TSH and the thyroid receptor and RXR. Like those things are all very important, but we're also focused on teaching you things like professionalism and communication and collaboration with interprofessional teams to ensure that when you do go out on your clinical rotations and when you are applying for internships, that you have the appropriate interpersonal skills as well. Okay. I want to talk a little bit about finances because this is a question that we will typically get. I don't know if I see anywhere in there right now. Not yet. But people will often ask, is there financial aid available? Are there particular loan services that you would recommend? So firstly, we don't recommend any particular loan servicer. We don't recommend any particular types of loans for your medical education. We will work with finance departments from states and provinces where students are seeking loans. We will also work with private or nonprofit lending. We don't recommend any particular products or any particular services to our students at any time. We do have a large number of students who do continue to work during their preclinical years to support the financing of their degree. All of our students during the clinical years, because clinical day-to-day is basically a 9 to 5 Monday to Friday job. We don't have most students are not working during their clinical years, and if they are, we don't know about it because we don't allow our students to work during their clinical years because of the type of schedule that they have. So what we do suggest is for students who are part of their financing for their degree is to continue to work in their preclinical years, is that when you start the degree that you take a leave from work for the first unit of medical school, which is called General Principles. And that will give you a good idea of the amount of time that you have if you need to continue to work or would like to continue to work. Versus the amount of time that you'll need for your studies. We typically recommend that students devote a minimum of 40 and more appropriately about 50 hours a week to their studies, including time in class. So it's very difficult for for you to work full-time on top of that, but some students do find ways to make that work depending on the type of work that they do. Also in the preclinicals, we have 2 weeks break between each class. So some of our students do work during the break if they're able to do that. So it's not something that we recommend students do to finance their degrees, but that's just the reality of how some people need to live and work. Many of you during your bachelor's degree, or if you've done a master's, may have had outside employment as well. So you could use some of the rules that you applied during that time in balancing your studies versus work. But I will tell you that the academic load during the clinical years is very rigorous, very heavy. So we highly recommend that students who are planning to work do take those first 8 weeks off. Okay, I'm going to go back to your questions. I'm going to go off of my slide for a moment. Okay, is there a placement in New Jersey, USA, or close to New Jersey? We don't currently have a placement in New Jersey, USA, but that doesn't mean that we won't by the time that you're doing clinical rotations. We don't, we kind of keep monitoring of availability and our students' needs, and we do respond to that. One of the things that is helpful about being a smaller university is that we can provide kind of one-to-one services for our students, and in states where we are allowed to have clinical rotations. Not all states allow that because each state has different laws for the types of medical students that they will allow in their facilities. We do keep abreast of those and ensure our students are able to find and keep rotations in areas that work for them. That doesn't mean that we will definitely have that. We make no guarantees about clinical rotation site availability until the time that you are in clinical rotations. Okay, is NewMed linked to OUM? We do have some linkage between NewMed and OUM in terms of the connectivity of our overlying companies, but OUM and NewMed are separate institutions. So there's no NewMed is a different institution from OUM, but they're kind of like a different branch of the tree. Okay, Fui wants to know, is this the same for New Zealand students? Sorry, I missed that if you have asked already. Fui, I'm wondering if you're asking about, like, can New Zealand students also arrange their own rotations? If that's not your question, just pop a clarifying question or clarifying answer for me in the Q&A. But yes, the same for New Zealand students. There are rotations available in New Zealand on the island. I don't know if on both islands. And our New Zealand students are also able to identify sites that they would like to rotate, and they can work with our dean's office to have those approved. Okay, so Anonymous wants to know, do we need to arrange our own accommodation for clinical placements in other states? Yes, we don't provide accommodations at clinical sites, except for at the TTM hospital in Samoa. We have an office there that supports students with things like their visa requirements, getting to and from the airports, how to get around the island, how to use taxis, how to book accommodations successfully. So we do have some support in Samoa, but not for individual states. Okay, can I please share how long each clinical rotation is so we have an understanding of the leave required from work every year? So your clinical rotations run throughout the entire year. So how it works is that, so in Australia, you may do your clinical rotations in segments, which means that you might have a family medicine rotation, which is a total of 8 weeks, and you may choose to do 4 weeks of your family medicine in one practice and 4 weeks in a different practice, so that you'd have 2 segments of 4 weeks each. So clinical rotations run for the whole year, so the whole time the university is open. So we close for 3 weeks over the December holidays and over New Year's, and then we're open again. So at all other times of the year, clinical rotations are running. So students have clinical rotations that are of different lengths. So I just mentioned, for example, that family medicine is 8 weeks, internal medicine is 10 weeks, so on and so forth. And we recommend that students take 2 weeks in between each rotation. That allows for them to do things like submit their logbooks of the patients that they've seen. Students are required to do case studies, so they do write up a case study of their patients, and not all of their patients. They select a few patients to do a case study, and they take a final exam in each rotation. So students are given 2 weeks between each clinical rotation in order to complete those requirements. That is not a mandatory 2 weeks. So some students would like to get their clinical rotations done faster or want to go in between segments a little bit quicker than that, and have the opportunity to do that based on their own schedule and the scheduling that's been offered to them. So some students do end one rotation on a Friday and start a next rotation on a Monday. It's not mandatory to take that 2 weeks. So again, we do not recommend students are taking that time to seek other employment. However, during the preclinical period where your classes are conducted via Zoom, those classes are scheduled, and there are 2 weeks break between each of the preclinical classes where you don't have any work. You're really supposed to take that time off to kind of refresh, recharge, reconnect. Those are the times that I was recommending or saying that you do have those times off, and then the academic calendar is available each year. So if you are working and need to have that schedule for work of your availability, that's all published in advance and available to you to share with work. Anonymous wants to know, do you have clinical rotations in Adelaide, which is in SA? Yes, we do. And since Anonymous also wants to know, since OUM is based in Samoa, as a US student, are there any additional examinations or licensing requirements beyond the USMLE exams that I should be aware of? So all students, all medical students in the US take the USMLE, United States Medical Licensure Examination Step 1 and Step 2 during medical school. So OUM students who are on a USMLE pathway, meaning that they want to complete clinical rotations or practice in the US, will take the USMLE exams. All international medical graduates get an ECFMG certification when they're applying for licensure and residency. So it's not an additional examination, but it's a step where you and the school are filling out paperwork to provide documentation that you're eligible for licensure in the United States. So OUM, the North America Dean's Office at OUM, works with all of our US-based students to fill out their ECFMG paperwork for their licensure. Okay, Sejal wants to know, I understand that the preclinical years are conducted online. How accessible is support from the academic team during this time? I'm going to pull up my share screen again because we're going to talk about the day-to-day in the preclinical. Okay, so in the preclinical years, you're taking one class at a time. So that means you're studying the cardiovascular system intensively, just the cardiovascular system. Then you let that go. Then you're going to study the urinary system, just the urinary system intensively. And then you're going to finish that. Then you're going to study just the pulmonary system and finish that, so on and so forth. Okay, so the way that the preclinical classes are structured is that you get a set of short pre-recorded lectures that are informational type lectures that have some interactive components, but they're recorded. So you'll get those on a Thursday if you are in North America, or a Friday if you are in Australia, Aotearoa, New Zealand, and Samoa. The reason why you get it one day later is because there's a 14-hour time difference between the two. So everybody's getting it at the same time. It just happens to be different days of the week because of the time difference. So you get those lectures on the Thursday or Friday, and then the following week you have 3 classes that you go to discuss those topics and commit that information to memory, to learn clinical skills associated with it, to apply them to clinical cases, to do problem-based learning, to support your integration of that material. So classes are offered twice a day. You don't go to class twice a day, you just choose one of the times of day to go. So they're offered at 8 p.m. On Tuesday, Wednesday, Thursday in North America, and at 8 p.m. on Tuesday, Wednesday, Thursday in AEST time, so which is Brisbane Standard Time. So that's basically that you can go to class kind of early in the morning or later in the evening. You don't go to both classes, you just go once a day. So yes, those classes are conducted online, but they are live Zoom sessions like this. So the only difference between this classroom and that one is that students are also on microphone and have videos on, and they're able to chat. We have students from all different walks of life. So sometimes there are dogs that are attending with their students. Sometimes a small little person will come in wanting a snack. It's a very nice, fun, welcoming environment, but it's also intense because you're thinking about how to apply these topics that you've learned to patient care and how to integrate them, how to learn more about them, and how to kind of commit them and connect them to the other things that you've learned. So how accessible is support from the academic team during this period? So each preclinical class is supported by a course director, as well as a deputy course director. So the course director and the deputy course director are going to be the ones that are there live in class with you. So they're there for you in person those 3 times per week. They also each have office hours every week, so you can book time with them one-to-one or in a small group. Like if your study group wants to meet with them and ask them questions, they have office hours that are available every week. So you can meet with them one-to-one. In terms of the other people in the academic team, so there's also a director for the entire preclinical program. So if you're having any needs about kind of going in between classes or having needs about examinations, you can go to the preclinical director. We also have an IT support team. So if you're having trouble accessing your learning materials, you can send a support ticket to them 24/7, 24 hours a day, 7 days a week. We also have a team that supports accommodation, equity, and inclusion. So if you're a student with a disability or a medical condition and you have some support needs there, that's under my office. And then we also have for students who are entering the university, the first 3 to 4 months, we have our student ambassadors, which are students in the late preclinical and clinical years that support your transition to becoming a medical student and can support you learning anything you need to know about the university or tips and tricks they've used. Also during orientation, you'll get to know your entire cohort. So the cohort is a huge source of support, as well as, so cohort is like basically your class, and study groups and everything are formed during orientation. So I can't tell you like on a scale of 1 to 10 how accessible the academic team is during this period, but what I can tell you is that because we're specifically a teaching university, we're not We're not a faculty who are focused on research or on product development or R&D. All of our faculty are specifically focused on teaching, that we're very accessible, and our goal is about supporting student learning for each and every student in our course. Okay, Claire wanted to know about financing options, loans in Australia with minimal interest or interest free. So we don't provide any advice or referrals for loan servicing in Australia or in any of the other jurisdictions that OUM serves. But what I would suggest is to do your research online about the servicing options that are available to you. And anything that you have questions specifically about using at OUM, our bursar does provide a service for anyone that's accepted into the university to have a discussion with her about any of the products that they're considering using, so that you know what may or may not work for you at OUM. And again, I do suggest going back to that webinar that Ms. Susie, who is our bursar and Chief Financial Officer, did a couple of months ago if you have other financial questions. Okay, oh my gosh, there's so many good questions in this Q&A. Okay, I'm going to answer this one. What are the hidden costs, placement costs to the degree? So we really do our best not to hide any costs associated with the degree. So we talked a little bit about credit point cost. We do also have fees that are incorporated in our tuition costs. So the fees like for our examination proctor and for our library fees, our student cards, all of that is incorporated into your credit point costs. So there's not additional fees for that. There are costs for clinical rotations. Hospitals do charge fees for clinical rotations in all of the areas that OUM serves. So all medical students that are doing clinical rotations in any of those 5 countries right now are paying fees to the hospital for their clinical rotations. So the university is not charging those fees. No universities are charging those fees. Those are fees that the hospitals charge for the pleasure of company of medical students. And we cannot keep a log of that because we don't have any control over the costs that they charge. We do have some, I wouldn't call them hidden costs, but we do have some behavioral based fees. So for example, if you have late payments, there's late payment fees. If you lose your student card, there's a cost to replace your student card. So there are some behavioral fees associated with kind of not paying things on time or misplacing things, but we don't hide any of the costs associated with our degrees. Okay, Sumia wants to know, on the website, it outlines that the medical course is 4.5 to 5 years. Can you please share how many years of this is dedicated towards clinical and preclinical years? So typically the preclinical years take 2.5 years. That includes our clinical transition unit where I was showing students at the Brisbane-based facility. And then the clinical years take about 2 years. And then it can take a little bit of time for students to do things like complete their research, take their final clinical exams, so on and so forth. So that's where the 4.5 to 5 years comes from. Anonymous wants to know, is the Australian and US curriculum the same? So students in Australia, students in the US, Canada, Aotearoa, New Zealand, and Samoa, they all take their preclinical classes together. The curriculum is the same. So the thing that we have to be careful about is like the units, making sure that you're learning the units for your particular country. So whether you're using like milligrams per deciliter or whether you're using micromolar, so on and so forth. So we make sure that we provide both sets of information. So the curriculum that is provided is the same for all students. What I will say though is that part of the the way that the classrooms are is that you will have students from all 5 of those jurisdictions. And so they get to discuss how things are different in each country, or how things will be applied in each country based on that. So I would say that the curriculum for everyone is delivered. It is delivered to everyone, but there is an enhancement in terms of what you will learn based on the fact that you're going to be in classrooms with students from different areas. Okay. Bruno wants to know, I'm very interested in applying for the January 2027 intake. Oh, that's great. From an admissions perspective, what qualities, experiences, or characteristics make an applicant particularly competitive or stand out during the selection process? Additionally, if I submit a complete application well before the September 1st deadline, will my application be reviewed earlier, or are all applications reviewed after the application deadline? Thank you. Okay, so from an admissions perspective, we have, I'm going to actually have a slide on this. We have some strict requirements that we do look for in our candidates, which I'm going to show you now. Okay, so here are admission requirements. So firstly, you have to have a bachelor's degree, and it has to come from an accredited institution. You have to have a cumulative GPA of 3.0 on a 4.0 scale, or its equivalent. Okay. One thing that I want to say about this is that, yes, this is an admissions requirement, but if you're sitting around a 3.0, if you have slightly less, or, if you have, this is your cumulative GPA. So maybe you have multiple degrees, and maybe you have one degree that's like really pulling things down. You have a good explanation for that, and there's a good reason why, you didn't perform as well as what your potential is in that degree. We will still take your application, even if you don't meet that 3.0 on a 4.0 scale. So if you are sitting there and you're saying, oh, I can't apply because I don't have a 3.0 on a 4.0 scale, what I would suggest you do is talk with the admissions counselor about whether you will still be competitive, or whether you should still apply. We do have this as an admission requirement, but we are not interested in just your numbers. We are interested in you as a whole person. When we commit to having a student at our university, it's because we're committed to them as an entire human being, and we're committed to educating them as an entire human being. They're not a number to us, and their numbers and statistics are not everything that tells us the story about this person. So don't be discouraged if you don't have that. Simply talk to an admissions counselor before you apply. Okay, you have to have English language proficiency, because all of our curriculum is in English. All of your clinical instruction is going to be in English, so you must have English, meet the English proficiency requirements. There's a little bit more information on the website about how to meet that requirement. And you must be a citizen or permanent resident of one of the 5 countries that I've been speaking about today. So in terms of like what qualities or experience or characteristics make you more or less competitive within that space of requirements, we're not interested in just taking one type of student that has like one set of character. Like, you have to be really motivated, you have to be like really smart, you have to be really you have to be like really just focused on a goal. That's great if you are that person. We're interested in you, but we're interested in a depth of experience, a quality of who you are and what your experiences are, how that has shaped you, how that makes you a unique individual, how that has shaped your empathy and motivation for the profession. So we're really we want to get to know you, what qualities you have, what characteristics you have that affect your motivation, that color, that make the rainbow of the empathy that you have, that are going to provide really a diverse and high quality experience for the other students that are going to be in a classroom with you. So we're really looking for diverse and unique individuals, not just specific numbers. And we're just really looking, when you go through the admissions process, for you to be yourself, to be really honest about your goals and what you want to get out of this experience and how we can help you do that. We really want to take in students that are going to be a great fit for our university and our community. And we don't know that from just looking at your transcript or reading an essay or just reading the recommendations about you. We get a sense of that from speaking with you, from hearing about what you've learned in your life and how the experiences that you've had made you who you are, made you want to pursue this type of career. So I would say that the characteristics, qualities, and experiences that make someone an ideal candidate are someone who has had experiences that they've learned from, someone who has characteristics that to demonstrate their level of empathy and aptitude and motivation for completing this type of degree, and have qualities that enable them to be a honest, empathetic, smart, kind, motivated individual. That's what I would say. But there's not one type of person that fits within that. Okay, I'm gonna try. I'm at 9 o'clock. I'm gonna respect everyone's time and say we're at the hour. And that if you need to go, please do. I'm going to stick around and answer 3 more questions. And then the rest of the questions I'm going to send off to our admissions counselors. So if your name is associated with your question, and you're already in our roster, they'll get back to you specifically with an answer to your question. If it says anonymous, they don't have a way of getting back to you. So you may have to connect with our admissions office directly to have that question answered. But I'll do my best. I'm going to answer 3 more right now. But for those of you who have to go on the hour, it was so lovely to have you. And I hope to see you again at our webinar next month. And I hope that if you haven't yet, you reach out to our admissions counselors and get a chance to know us a little bit better. And I hope to see you as applicants for our 2027 January cohort. Okay, I'm going to take Tansia's question specifically for Australia. Victoria, is OUM affiliated with any hospitals for clinical placements, or are students responsible for sourcing and obtaining approval for their own placement sites? Okay, so there are placements available in all the states in Australia. If students have a particular rotation site that they are interested in, they can identify that to the university, and the university will work with the rotation site to make sure that it meets the requirements and that it's a safe place for you to go, and it will meet the requirements for your degree as well. Okay, could I explain a bit more in detail that you do clinical placements in Samoa for how long? So students do a minimum of 4 weeks of clinical rotation in Samoa. They do this in the city of Apia at TTM Hospital in Apia. Students get to select the type of clinical placement that they do in Samoa. For those 4 weeks. A really popular one is OBGYN, because you get a lot of hands-on experience that you don't have available to you in the other countries. But psych is also a really popular rotation, as well as surgery in Samoa. But again, students get to select the rotation that they would like to do, and then go for 4 weeks. Okay. I've got 2 more I can answer. Are there a mix of lectures from Samoa, Australia, and the US? There are lectures from Samoa, Australia, US, Canada. I'm actually located in Canada, as well as Aotearoa, New Zealand. Anonymous wants to know, can we ask questions and confirm our understanding in the Zooms? Absolutely. The Zoom live sessions in the preclinicals, as well as there are live sessions offered in clinicals as well, not on a weekly basis, but there are scheduled sessions available. Yes, students are encouraged, just like I've encouraged you all today, to answer questions. We use chat windows. Here we're using the Q&A. but in our classrooms, we use chat windows so people can see kind of the running set of questions and they're welcome to answer each other's questions. We also allow our students to raise hands and ask and answer questions. And we do have students who are presenting information from questions that they are answering as well. So it's a really interactive type session. Those are not lecture-based sessions. They're really designed for you to participate and to have a chance to integrate the knowledge that you've learned. Okay, I'm answering this last one bonus question. And then I'm going to go. Okay, what's the minimum passing grade required for each unit, and what academic support is available if a student is struggling? Our passing grade is 60%. That doesn't mean that you have to get a 60% on each examination. It just means you need a 60% total in that unit for a pass. If you fail a unit, meaning you get less than 60%, we do have a policy that allows for resit examinations for different reasons. So sometimes you're able to resit a final examination, but you need to get a 60 or above to pass that unit. If you don't pass a unit, you're able to retake it when it's offered again live. In terms of academic support for struggling students, so we do have student success advisors, which are one-to-one advisor available for every student at the university. There's no additional cost to having a student success advisor. All students who are on an academic path of academic struggle are assigned an SSA, and our preclinical and clinical directors are also looking out for students that we consider higher support needs or at-risk students, either through their own self-identification or for things that come up through their exams. So we're really committed to ensuring that our students are doing well. We're committed to ensuring that we're preventing failures where we can, and where failures do occur, that we have a clear pathway of mitigation to ensure that that student can still complete their degree. Okay, I'm sorry if I did not get to your question, but I still think it's a really important one. So I will pass these along to ensure that you do get answers. And I hope to have our Australian graduate come to an upcoming session because you may have some additional questions for them about what this was like for them personally, some of the things that I've talked with you about today. So thank you so much again for joining me. And if you join me for a little bit of extra time, thanks for allowing me into your space for some extra time. I hope that this has given you some further information about whether OUM would be a good fit for you. And please, if you need some further information to support your decision-making, do not hesitate to reach out. We are here to support you as you become part of our community. And if you become part of our community, where I am here to support you as you become prospective students, as you enter as a new student, as you go through your preclinicals and clinicals, and when you walk the stage for graduation and become an alumni. I am a part of that journey, so I'm looking forward to working with you more as we move on together in your medical student journey. So thanks so much for your time today, and talk to you all again soon. Bye for now.